Good morning, friends. I'm State Senator Carolyn Comita. Thanks to each of you for joining us to recognize National Midwifery Week in Pennsylvania. Thank you so much to the March of Dimes, the American College of Nurse Midwives, and all of the midwives who are here with us today. I also want to thank the moms and families and babies. How about these babies here today? so precious, and it makes this moment even more special. And thanks to the moms and families for being with us to share not only those cute babies, but your stories about the important work of midwives. Thank you to my friend and Senate colleague, Senator Rosemary Brown, for her leadership on this issue. The practice of midwifery dates back thousands of years. In America, it was the most customary practice for pregnancy care and childbirth in the early 19th century. Today, as expectant mothers and families face a crisis of access to care, midwives represent a largely untapped resource when it comes to quality maternal care and infant health care. Due to a shortage of doctors and medical staff and other factors, we are seeing the spread of maternity care deserts, places where there is a lack of maternity care resources, including hospitals, birth centers, and OB/GYN providers. Did you know that in Pennsylvania there was a 14% decrease in the number of birthing hospitals between 2019 and 2020? And last year, there were 643 babies born in maternity care deserts. Meanwhile, among developed nations, the United States is one of the least safe places to be pregnant or to give birth. What can we do about this problem? One big way that we can help is by empowering midwives, licensed healthcare providers who deal with pregnancy, childbirth, newborn care, and postpartum health. And may I say that both of my children were born in a birth center, and my pregnancy and birthing experience and postpartum care was all care given by the midwives at that birth center. Board-certified midwives do much more than assist with childbirth and newborn care. They also provide clinical examinations and screenings, identify high-risk pregnancies, and help new moms learn to properly care for their babies and transition into their roles as parents. That is why I am a strong supporter and co-sponsor of Senator Brown's Midwifery Modernization Act, Senate Bill 1262. This legislation is about empowering midwives, aligning Pennsylvania with national trends, expanding access to essential care, and improving health outcomes. Pregnancy and labor are very personal experiences. Modernizing our legislation to further integrate midwives into the women's health workforce will not only expand access to care, but it will also provide women and families with more choices. As a mother and a grandmother, I am eternally grateful for the quality health care that my family and my children and grandchildren have received. Midwives have been helping generations of women and families navigate pregnancy, childbirth, and postpartum care. They're a vital part of maternal health care process. It's time to update our regulations to unlock their full potential in serving Pennsylvania moms and families. Thank you all for being here and for your important work. Let's pass Senate Bill 1262, the Pennsylvania Midwifery Modernization Act. Thank you.